I'm Chris Peterson, and in this next video you'll be seeing a fairly typical sexual history being taken from a man who presents having moved to a new community, to a new doctor, just for a periodic health evaluation, a checkup. He does not bring to the doctor any particular sexual issues. The teaching points for this interview are three. First is that the sexual history should be a part of every comprehensive getting to know you medical interview. Second is the timing of the sexual history, which can be either during the social history portion of the interview or perhaps during the review of systems, though there may be other places where it's appropriate as well. And the third is that the screening questions that need to be asked include, can I ask you questions about your sexual history? And obviously the patient needs to be able to answer no, and you need to be able to take no for an answer and to stop the conversation at that point. Then asking something about whether the person is currently in a sexual relationship or whether they have been in the past, and something about what they have used, if needed, for contraception and, no matter what the circumstances, for protection from sexually transmitted diseases. You need to know whether their sexual relationships have been with men or women or both in order to assess their risk factors for sexually transmitted diseases and to make recommendations about testing. And then it's important to ask whether they or their partner have ever had any sexual difficulties or whether they have any current sexual concerns that they would like to bring to you. Look for all these points in the upcoming video. Okay, Mr. Smith, in our first Getting Acquainted interview, we've learned some about your past medical history, and I'd like to see if there are any other issues that we can address today. I need to ask some fairly personal questions about your sexual history. Will that be okay?
Sure.
All right. Are you currently in a sexual relationship?
Yeah.
All right. One partner, more than one?
No, it's just my girlfriend.
All right. And are you using anything for protection from sexually transmitted infections or for contraception?
Just condoms.
Condoms. Are you happy with how condoms are working for you as a couple? Great. Have you had other sexual partners in the past?
I had one girlfriend before my current girlfriend.
Okay. Did you also use condoms in that relationship? All right. Any male partners ever?
No.
Okay. Any concerns about sexually transmitted diseases in this relationship or the previous one?
No.
No? And do you or your partner have any sexual difficulties or concerns that you'd like to address?
No, I don't think so.
All right, fine. If anything ever comes up, please know that this is an okay place for us to talk about those kinds of issues.
Okay.
All right? Good. We've just seen a videotape of a typical interview with a male patient who doesn't have any sexual problems or sexual issues. Remember the three teaching points. Taking a sexual history is an important part of the comprehensive medical interview. The sexual history can be done during the social history, along with inquiry into nutrition and safety issues and so forth. And that the screening questions that need to be asked are simple and few.